Welcome back to Crush Medical. I am Dr. Ahmed, your lead board instructor, and we've got another high yield board question here. Make sure to like and subscribe, help this channel grow so we can continue putting out more free educational content. Check us out at crushmedical.com, where I've got a free MCCQE1 study guide that will essentially not only help you pass on your first attempt, but make sure you score well, okay? Also, I have a very high yield Anki deck. That's one of our best sellers. Check that out as well. As well as some premium CaRMS services, mentorship, coaching, as well as mock interview bootcamps. So all these services and everything are available at crushmedical.com, okay? Let's jump right into this question. We've got a hospital nurse recovering from a recent upper respiratory tract infection who comes to the clinic with a 3-day history of bilateral, red, watery, irritated eyes. She is eager to return to work. You swab the eye for bacterial culture. Which of the following is the best next step? Okay, so very common scenario, textbook case you will actually see in any walk-in clinic or any clinic across Canada. And what is the concern here? So it seems like the nurse, she's dealing with some URI, she's recovering, she still has some red watery eyes concern. Outside of that, she just wants to go back to work, right? So it says that we've done a bacterial culture swab. Okay, that's a good place to start. But ultimately, what is the next best step? Okay, so now that we've established a framework, let's actually go through the options. We'll start with E. So send her to ophthalmology to rule out a herpes simplex infection. So that seems quite overboard for this concern. Again, she's dealing with a viral URI, which is one of the most common things that that occur. But does that warrant escalating this to ophthalmology and sending them for herpes simplex infection? That would be incorrect here, right? So herpetic keratitis, again, that's a different clinical picture, right? That would present unilaterally with severe pain, photophobia, and you get these ulcers, right? They call them dendritic ulcers. Not this bilateral post-URI picture. So two different clinical scenarios, definitely does not warrant seeing an ophthalmologist, okay? Incorrect. Option D, using an NSAID eye drops should the culture return negative. So basically they're saying wait on the cultures. Once it's negative, prescribe NSAIDs for the eye concern. Again, that would be incorrect here, right? It's good. It provides symptomatic relief. It does nothing about the contagiousness, right? So she still has a viral URI. She can still transmit this, especially because she's a nurse. If you go into a clinic, a hospital, not just staff, but also patients, right? So that would be incorrect here. Okay, it doesn't really address the patient's concerns here. Moving on to option C. So exclude her from work until the eye findings have fully cleared, regardless of a negative bacterial culture. So again, going back to the idea that she is eager to get back to work, this is probably going to be the correct option here, right? So recent URI, she's got bilateral red watery eyes. We can call this just adenoviral conjunctivitis or viral conjunctivitis. Highly contagious for a patient facing healthcare worker, right? A negative bacterial culture doesn't exclude the virus, so she stays off until symptoms resolve. Very important, right? So we can't just give her some pain medication and send her back into her clinic while she still has this viral infection and she's still, still symptomatic. That's just not a viable solution here, right? So again, why? It's highly contagious. It can spread readily. More important than that, negative bacterial culture does not mean that they are not infected, right? This is bacterial, right? It doesn't exclude the idea that it's a viral conjunctivitis, which is in fact the most common type of conjunctivitis, right? And ultimately, bullet 3 is that this is self-limited, right? She doesn't need any antiviral. She doesn't need any severe medications. Perhaps NSAIDs and supportive measurements can help, but more than that, supportive care, right? So cold compresses, artificial tears, hand hygiene, very, very important for this, especially because we're dealing with viral URIs. Hand hygiene becomes very critical, and that's a very high yield thing to be aware of. But more than that, fluids, make sure they're hydrated, and generally this self-resolves over a few days to a week, and then they're able to get back into clinic, get back to the hospital, right? So very high yield question. It's relatively easy, but the management is extremely important, okay? High yield exam tip is recent URI, bilaterally red watery eyes, adenoviral conjunctivitis, highly contagious. Okay. Let's just see what the other options were too. So option B, permit her to return once the bacterial culture is confirmed negative. Again, so we're basically saying wait on the cultures. If it's negative, send her back to work, right? That's just not a good option because it doesn't exclude a viral infection, which she still has. She's still symptomatic, so therefore we can't send her back to work, okay? And then option A, begin antibiotic eye drops and let her resume work pending the culture. Just not a good option, right? So antibiotics doesn't treat a viral infection or make her non-infectious, and returning a contagious worker, now we're just putting others at risk, okay? So very high yield question, very simple, often overlooked, especially when it comes to management and what would be the next step, especially work-related concerns. So be aware of this question, and we'll see you in the next one.